Today marks the beginning of my mini-series all about epidurals. And while that might seem like an odd topic to be covering as someone who is an advocate for low intervention unmedicated labor, I also know that the epidural is here to stay. So whether you're choosing to pursue a natural labor or plan to get an epidural, I hope this mini-series will be informative, brief, and helpful to you as you navigate how to best utilize or avoid this common intervention. So without further ado, let's get into it. Do you believe that Jesus belongs in the center of every part of your life, including labor? Does a natural or low intervention birth appeal to you, but you feel overwhelmed on how to prepare for one? Are you so ready to feel confident, at peace, and even excited as you partner with the Lord to bring new life into this world? Because if so, you are in the right place, friend. Welcome to the Faithful Labor Podcast. I'm your host, Audrey Stinson, Bible-believing Christian, childbirth educator, wife, and mama to 4, 2 born via C-section and 2 delivered at home. After going through 2 challenging deliveries where I outsourced my birth decisions and left my faith out of the process, the Lord graciously led me to experience 2 redemptive home births. Now, they are redemptive not because they happened at home, but because through prayer, study, and wise guidance, I learned to trust God's design for birth and believe wholeheartedly that He was with me, for me, and faithful through it all. In this podcast, you'll gain a deeper understanding of physiological birth, hear inspiring stories from fellow Christian moms and experts, discover holistic tips for pregnancy and postpartum, and above all, find biblical encouragement to help you keep Christ at the center of your birth preparation. So grab your water bottle, settle in, and let's get your heart and mind prepared for the faith-deepening experience of laboring with God and for His glory. Well, hey everyone, welcome to the first episode in the Epidural mini-series. And like I said in my opener, I know it seems kind of weird that somebody who is as big of a proponent of natural, unmedicated, low intervention births as I am is talking about an epidural on her podcast. But really though, here's the deal, okay? The epidural is not going anywhere. It's just not. And there are times in which it can be a benefit, and because it's not going anywhere and it might actually be an appropriate option to choose at some point for you in labor, I think we need to talk about it. We need to talk about it. We need to address the pros and the cons, and we need to do it in a way where nobody's getting shamed, nobody's feeling judged, either way for choosing not to have one or for choosing to have one. But I really just wanted to bring it to the table, just kind of talk about the elephant in the maternity model of care in Western culture room, okay? It's the epidural. We need to know about it. We need to hear about the pros and cons and even the history. Like, where did it come from? What drugs are used during it? What does the cost look like? All of these things. And I really do believe that the more you understand about whatever the interventions are, you can be more informed in your choice to either say, no, still don't want it, or you can be more informed in your choice to say, you know what, I think I still do want it. And both of those options are equally okay. I might personally have my preferences, and I do, everyone does, but both options are okay. And I think we owe it to ourselves to educate ourselves on all the interventions out there, because they exist and we need to know what we're saying no to, and we also need to know what we're saying yes to. So I really do hope that this series can be informative, educational, and overall just helpful to you in whatever choice you make. I wanted to make it easy where you could just flip it on, listen to a quick episode, learn a nugget, and then take that as you will and apply it to your upcoming birth plans. So, and before we get into the actual meat of today's episode, where we're going to cover the history of the epidural, how it became popular, what it actually is, how it's administered, and then a little bit into the financial costs, I want to go ahead and take a moment and read a birth story to you guys. So this is something that I offer to all my listeners. There is a link that will be included in my show notes where you can go to a form and submit your birth story. I believe that listening to birth stories is one of the best things that you can be doing as you prepare for labor. And I want to give you a chance to be able to share your birth experience with another mama or lots of mamas who really, really need to hear that encouraging story. And so if you have a birth story that you just saw the goodness of God, you felt his faithfulness to you, you have some wonderful part of the story, or the story as a whole just left you feeling closer to the Lord and drew you into a deeper relationship with Jesus, I really want to encourage you to take a second, take a few minutes, and go submit that story so I can read it on the podcast. If you really just want to talk about your birth story and writing it out just won't cut it, you can also submit a request for us to get an interview on the calendar so you can share your birth story yourself with the world. So go to the show notes, check that out. I would love to hear from you. But today I am sharing Brittany Corn's story. So here is what Brittany had to say about her birth experience. My birth story begins long before the actual birth. My first birth was in a hospital in 2018. I wasn't necessarily disappointed, but there were things I wished were different. Then 2020 happened, and I got pregnant with my second daughter. The Holy Spirit told me right away that I was doing a home birth. I just knew it to my core. I was absolutely terrified because I had an epidural with my first, and I had always been just so scared of birth in general. Also, I'm kind of a wimp when it comes to pain, but I knew I just had to do it. It was like God put it in my head that it was the only option. Well, the birth ended up being so redemptive and freeing. I ended up birthing our daughter on our bed with nobody present except for my husband and mom because the midwife didn't make it in time. Our daughter was born just 45 minutes after contractions started. I remember saying, I want to do that again, right afterwards. It was still painful, but it was absolutely a gift from God, and I proved to myself that I could do it with the Lord's help. It has helped confirm for me that God is faithful and loves us so much and knows exactly what we need. Oof, Brittany, I love that story. I absolutely love that this experience confirmed for you God's faithfulness and love for you, because he absolutely does. And I think it's so beautiful, so amazing that God uses labor to draw us into this deeper understanding of his character and provision and love for us. It's such a gift, and I'm so glad you got to experience it. So thank you so much for sharing this story. I know it was a huge encouragement just to me, and I bet it was an encouragement to the other people listening today too. Now, without further ado, let's finally get into the meat of today's episode. Let's talk about the early origins of the epidural. So the epidural can be traced back to 1921 when a Spanish military surgeon named Fidel Pajis Mirave successfully developed and documented the technique of injecting local anesthetics near the spine for surgical pain relief. By the mid-20th century, epidurals had been adapted for use during labor as advancements in anesthesia made the procedure come across as safer. Hospitals, particularly in the United States, began routinely offering them as a way to provide women with a more, and I'm doing air quotes, even though you can't see me, a more civilized birth experience. And this was largely influenced by cultural preferences for comfort and medicalization. And it was also during this time that childbirth started to be marketed as a pain-free, and I'm doing air quotes again, a pain-free or doctor-controlled event, which, of course, thus further reinforced the epidural popularity. And today, epidurals are the most common form of pain management for women giving birth in hospitals. In some areas, over 70% of women choose epidurals during labor. Okay, now we are going to get into what the administration of an epidural looks like and how epidurals actually work inside the body. And just as an aside, remember, today I am merely sharing the matter-of-fact details. I'll be getting more into the risks versus benefits in future episodes within the series. So, you walk into the hospital, you agree to get the epidural. What is happening next? The first thing that is going to happen is that your nursing staff is going to make sure that you get something called a fluid bolus. So basically what that means is they're going to be rapidly infusing 500 to 1,000 milliliters of fluid into you, and it's either going to be something called normal saline or lactated ringers. Those are the most common too. And that is the first thing that has to happen before you get your epidural on board. So why do they do this? What is the importance of the fluid bolus? This prevents a drop in blood pressure. The epidural blocks sympathetic nerves, which normally help keep blood vessels slightly constricted to maintain blood pressure. So if you're blocking those sympathetic nerves, that means those nerves are numbed and the blood vessels are relaxed, which can then cause a sudden drop in blood pressure, or something called hypotension. If blood pressure drops too much, it can then reduce blood flow to the placenta, which obviously potentially affects the baby's oxygen supply. The IV fluids help increase blood volume to stabilize blood pressure before the epidural takes effect. So when the anesthesiologist comes in, and granted, it's important to note that depending on your hospital policy, you might not actually get to have your husband in the room with you. At least that is how it is here in one of our hospitals in town, which is really sad to me, but that's just how it is. Apparently there has been issues where husbands get really squeamish and then they pass out when they watch their wife getting the epidural. It's a thing. So just check is all I'm saying. Check and make sure what the policy is where you're at. But the anesthesiologist will come in. The patient's going to be asked to either sit up or lie on their side and curl forward to open the spaces in the spine. Then the anesthesiologist will clean the lower back with an antiseptic and numb the area that he's going to place the epidural in with a small needle first, using a local anesthetic. And this is probably going to feel like a pinch or some burning, but it's pretty quick. And once the area is numb, then the anesthesiologist will insert the larger needle into the epidural space, which is just outside the spinal cord. So it's not going into the spinal cord, it's going to be in the space just outside of it. And typically at this point, you're not going to feel the needle itself, but you are going to feel a lot of pressure. Then after the needle has come in, a thin, flexible tube called a catheter will be threaded through the needle and then left in place while the needle is removed. So it's not just something they stick in, insert, give the medicine, and then voila, you're done. It is something that remains in your back throughout labor or until they remove it. The medication does not go directly into your spinal cord, like I already said, but rather it covers the surrounding nerves. So pain travels through sensory nerves in the spinal cord to reach the brain. And the epidural medication, which is typically a mix of local anesthetics like bupivacaine and sometimes opioids like fentanyl, block the sodium channels in these nerves. And so if you're like, I don't know what that means, Audrey, what does blocking sodium channels mean? Basically, all you need to know is these channels, when they're blocked, this prevents pain signals from being sent to the brain, leading to numbness and pain relief. The sensory nerves, which send pain, temperature, and touch signals, are blocked first. So that means that the contractions feel less intense or they disappear completely. And if you listen to one of my earlier episodes with Emily, my doula friend, she actually talks about the importance of having a little bit of pressure that you're still able to feel rather than just having everything blocked entirely. So that's what happens with the sensory nerves though. They either knock out all sense of feeling or you have it become less intense. And then after the sensory nerves are affected, then we got the motor nerves. And obviously those control movement. Those can also be affected, and pretty often they are, which is why a lot of women experience leg weakness or inability to move their legs at all, or some difficulty pushing because they cannot feel those sensations. The level of numbness, though, depends on the dose and type of medication used. So higher doses create more complete numbness, obviously, while lower doses may allow for more mobility. And those can be titrated or moved up, and they can also be titrated and moved down. So it takes about 10 to 30 minutes for full pain relief to kick in. That's another thing to consider if having an epidural is the choice that you end up making. It is not some kind of snap your fingers and it's gone. So you do need to make sure that you have done some prep work to deal with contractions in a different way rather than just expecting to avoid dealing with them altogether. Once the medication is stopped, though, sensation and movement gradually returns within a few hours. But again, just something to consider, that it's not just you turn it off and it's gone. It takes some time for that to wear off. Now let's get into the cost of epidurals. The cost of an epidural obviously is going to vary pretty widely depending on your location and healthcare provider. If you don't have insurance, you can expect to pay between $1,500 or $3,000. And some hospitals are going to charge upwards toward $5,000. And again, these are just ranges and loose averages. There are obviously going to be some cases where it's much, much more and some where it's less. And the cost of an epidural with insurance can also vary widely based on your location, hospital, and also your insurance plan itself. So the loose range for that with insurance is typically between $200 and $3,000 out of pocket. Again, it's going to be varied all across the board, but most insurance plans do cover epidurals, although the final cost is going to depend on the deductible, copay, and whether or not the anesthesiologist that you use is in your network. So some women end up paying very little, while others, unfortunately, get a pretty surprising larger bill. And there are, in some cases, and I found out that this is mostly not in the U.S., so you U.S. people probably this might not apply to you, but there are some cases in international healthcare services and systems where there are private hospitals who offer deluxe packages with personalized dosing, continuous anesthesiologist monitoring, or combined spinal epidural options. And that is going to be a wrap on today's episode. That is all that our brains are going to have to soak in on epidurals today. So if you enjoyed today's episode and you know somebody else or you have somebody else in your life that is expecting and they're not quite sure on the epidural, they haven't really looked into it enough to know whether or not they're going to take that path for themselves in their birth, maybe consider sending them this episode so they can have a little bit more information to wrap their minds around as they make their choices in preparation for birth. And remember, if you have a birth story on your heart that you know the Lord wants to get into the earbuds of other mamas who need that encouragement, who need your story, please head to the link in my show notes and share your story with me so I can read it to other moms on the podcast. I hope you guys have a wonderful week, and I will catch you guys next Wednesday. God bless. Thanks for joining me today, friend. If today's episode blessed you, the best way you can let me know is by leaving a written review on Apple Podcasts. You can also tag me on Instagram with a screenshot of today's episode at faithful.labor. Now, before we part ways, I'd like to pray Ephesians 3:20 over you. Now to him who is able to do immeasurably more than all we ask or imagine, according to his power that is at work within us, I pray that God would be mightily glorified through you as you seek to honor him with your faithful labor. Amen, and God bless.